Pepcid AC is used to treat ulcers of the stomach and intestines and to prevent intestinal ulcers from coming back after they have healed. Generic name famotidine. This medication is also used to treat certain stomach and throat esophagus problems such as erosive esophagus, gastroesophageal reflux disease, Zolling-Ellison syndrome. It works by decreasing the amount of acid the stomach makes. It relieves symptoms such as cough that doesn't go away, stomach pain, heartburn, and difficulty swallowing. Famotidine belongs to a class of drugs known as H2 blockers. This medication is also available without a prescription. It is used to prevent and treat heartburn and other symptoms caused by too much acid in the stomach, acid indigestion. If you are taking this medication for self-treatment, it is important to read the manufacturer package instructions carefully, so you now want to consult a doctor or pharmacist. How to use. Adults and children 12 years and over. To relieve symptoms, swallow 1 tablet with a glass of water, don't chew. To prevent symptoms, swallow 1 tablet with a glass of water at any time from 15 to 60 minutes before eating foods or drinking beverages that cause heartburn. Don't use more than 2 tablets in 24 hours. Children under 12 years ask a doctor. Contraindications. Heartburn can mimic early symptoms of a heart attack. Get emergency medical help if you have chest pain that spreads to your jaw or shoulder and you feel anxious or lightheaded. To make sure Pepcid is safe for you, tell doctor or pharmacist if you have ever had kidney disease, liver disease, cancer stomach, or long quad syndrome in you or a family member. Precautions. Drinking alcohol may increase the risk of damage to your stomach. Avoid taking other stomach acid reducers unless a doctor has told you to. However, you may take an antacid such as Maalox, Mylanta, Gaviscon milk of magnesia, or lates or Tums with famotidine. Pepcid may only be part of a complete program of treatment that also includes changes in diet or lifestyle habits. Follow a doctor's instructions very closely. Pepcid side effects. Get emergency medical help if you have any signs of an allergic reaction to Pepcid, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Stop using this medicine and call doctor at once if you have confusion, hallucinations, agitation, lack of energy, aphasia, fast or pounding heartbeats, sudden dizziness, like you might pass out, or unexplained muscle pain, tenderness, or weakness, especially if you also have fever, unusual tiredness, and dark colored urine. Some side effects may be more likely in older adults and in people who have severe kidney disease. Common Pepcid side effects may include headache, dizziness, or constipation or diarrhea.